No one told me anything, no one said anything to me. I just noticed that a lot of people started treating me differently. People were always saying several things behind my back. One of those discussions, I got to find out that this was what they knew, and this was why their attitude towards me changed.
It's not easy when you find out that the people that are supposed to take care of you, support you, care for you, are the ones that are not doing that.
I never knew that HIV can be a limitation to achieving my success.
It got to a point, I wasn't just bothered. I was like, let me just die. Maybe that will just make everything better.
Nigeria's largest city, Lagos, a bustling metropolis where diversity and dreams converge. Yet, where silence hides stories of isolation, fear, and rejection. Today, we are breaking that silence. Across office spaces and corporate buildings, workplaces should offer safety, unity, and purpose for all. But what happens when fear and prejudice infect the spaces? When the fear is of a virus and the prejudice of one's very identity.
My pronoun is he, him, his, and gay.
This documentary delves into the silent suffering of LGBTQ individuals living with HIV, navigating the unseen battles of discrimination within Nigeria's workforce.
Okay, I started serving in 2017.
When I know about my status, being an HIV-infected person, I find it difficult to look for a profitable job.
My experience has been a bit off.
Through stories of those affected, we aim to confront the stigma that not only harms careers but shatters lives. To understand the depth of this issue, at Think Positive, Live Positive initiative, we consulted experts across fields.
I started as a peer. That was back in 2009, and I think I've never even heard of the word HIV. As at the time, as at 2009.
I am a clinical psychologist. I've been practicing for the past 6 years in the field of mental health. And part of my stronghold also has to do with issues related to mental health of the key population.
I've been working as a legal officer for a sexual minority organization advocating for the rights and liberties of queer persons. I've been involved in and engaged in advocacy for the rights of queer persons. I've worked for a number of organizations advocating for the rights of queer persons in Nigeria.
My name is Patrick Akpan. I am the Lagos State Coordinator of Network of People Living with HIV and AIDS in Nigeria.
My name is Olanyika. I'm a legal practitioner.
As we peel back these stories, we discover how prejudice denies LGBTQ individuals not only equal treatment, but even the most basic respect.
So where I served, I was eventually retained at that job, and at that time I had stopped using my drugs for a very long time, and so it got to a point where I was falling sick almost every month. At some point I was always in and out of the hospital, and it was affecting my job. I always had to miss a lot of things, and it affected my job generally. And there was one of those days I fell sick and I couldn't go to the hospital, so I had to use the work clinic, and they ran some tests, and I wasn't really bothered. I didn't ask what tests they were going to run, and then they ran the test, and no one told me anything, no one said anything to me. I just noticed that a lot of people started treating me differently. There were a lot of people giving me some sort of attitude, and people were always saying several things behind my back. And one of those discussions, somehow I got to find out that, okay, this was what they knew, and this was why their attitude towards me changed. And some months after that, I decided to resign. I went back home to my parents. I served in Akure. I went back home to my parents. I stayed for a month, so I was away from work for a month. And when I came back, I decided, okay, let me just resign. And some days after I sent in my notice for resignation, they sent me a sack letter. And, you know, eventually, because it was not a comfortable space for me anymore, I had people talking behind my back, even people who claimed to be my friend, people who we had a very good rapport before they found out whatever had happened. They started talking about me, doing different things, not wanting to share things with me, not even want to have any physical contact with me. And so because of all those things, I just decided to leave that place.
We sat down with those who have been through it, real people whose lives were disrupted by discrimination. They share stories they've been forced to hide, now shared in anonymity, but with unmistakable pain.
The first job I was supposed to get when I finished school, was supposed to be from my uncle. So when I applied, they assured me that I was going to get a job, but I didn't know anything concerning medical checkup. So he did the medical checkup himself. He collected my blood sample, and later on, I think after a week, he came back and said, the job was not for me. It was after 2 days he told my parents about my HIV status and everything. And the thing actually had a negative impact on my family. And it was not really good.
For some, a single health test result marked the end of a promising career and shattered the trust they had in a system meant to protect them.
I got this offer from NLNG, and I passed a series of tests, both the written and the oral. And when it comes to the medicals, although before the job, I knew my status, but I wasn't really well informed. So I think we were about 6, that made it to the finals. So at the end of the day, we were given a form, and we were told to visit the company's clinic. And when we visited the clinic, they told us that the result will be out next day. So we are not meant to go because we are capped in the hotel. What it means is that after the medicals, you start your orientation immediately. So to my surprise, 4 persons were made to the final, while 2 persons were dropped, and I was one of the 2. So eventually I wanted to know why, because I know myself. I know I was sound, and I know I scaled through. So I never knew that HIV can be a limitation to achieving my success. So eventually I tried to find out, and I wasn't really giving a very good answer. What I was told was, here's the company decisions, that you didn't make the finals, that they are sorry, that we have your contact, whenever we have a need for you to come, we'll contact you. That kind of statement wasn't really going down well with me. So what I did was, because I have the company's kind of the information, like the HR, and so I had to write officially to the company, demanding to know the reason why I was dropped at the 9th hour. So eventually I was informed that because of my HIV status, that I might not be able to perform excellently well, so it was a blow to me. And so it took me a lot of time to get myself back to my feet, even with my academic qualifications, my experience, and a whole lot of things. So that dream died at that spot, and nothing was happened about that.
The impact of these policies doesn't end with job loss. For some, workplace discrimination seeps into daily interactions, reshaping how they are seen by colleagues.
I normally put my pills in my pill box, so my attention was needed immediately, so I had to ask one of the junior staff to please help me get something. Just open my drawer, you see the phone bust slightly, just bring it out. So I think along the way he opens it and he now finds out, and before you know it, I think he snapped it. And when he brought something to me, I noticed. Then my mental was like, well, I was like, nothing. But I felt that the countenance, it was looking at me as if, So after about 1 week, I started hearing some side talks. I started hearing some side talks within the space of the junior colleagues. There's people that normally uses pill boxes who are there. Some people even walk up to me. I was like, sir, I felt that I should let you know. Some people were now discussing that you carry drugs. Are you sick? We don't know that you are sick. At first, I felt very ashamed of myself. I now look at myself, how can I be able to stand? How do I even say? I don't even know what to say.
And then one of the things that was difficult was the fact that people didn't want to have physical contact with me, didn't want to have conversations with me. And when I started there, I was a school teacher. I was teaching English. And at a point, yes, they took me out of the class because they felt like I shouldn't be around the children and all. And so it was a problem for me because I was just there. I wasn't doing anything. And it was particularly painful because I had people that I was close with. I didn't mention, I bake cakes. And so it was a time I would always bring cakes, bring chin-chin, and it got to a point that even if I bring those things, no one would take them from me. And so it was painful because I'm like, you've eaten these things before, you've taken them from me before. So what changed? What made you change now?
Here I'm working because the time that I'm supposed to take my medication is in the morning, and it falls at that particular time that I'm at work. So there is a particular day that I'm taking my medication. So my co-workers, they ask me, they have noticed that I normally take this medication every day. They ask me, why am I taking this medication? I did not answer. But on one day, they took that medication to one of our because in our working space we have a clinic, which they took that particular medication to the clinician, and the clinician called me that, am I HIV positive? Which I said, yes, I'm HIV positive. So they said, well, okay, no problem. So I was asked to go, but with the fear that maybe they are going to escalate that particular my status to everybody, so I have to leave the work.
In our discussions with experts, we explore the deeper emotional toll that workplace discrimination takes on individuals living with HIV, especially those from marginalized communities like the LGBTQ population. The mental and emotional scars are often unseen but deeply felt.
So when we talk about workplace discrimination and stigma, it can come in different form, and we should also note something when it comes to MSM persons, and also when it comes to the aspect of HIV. That is intersectionality. So when we are talking about this intersectionality, it comes with a whole lot of higher discrimination as against just an MSM person or just someone living with HIV. So their own is at an heightened effect, and it manifests in various ways. For some, and what I want to say is it's a kind of microaggression. It's come in form of microaggression for most persons, where people give comments, where they make jokes, and giving those comments and making those jokes might not even look at something negative to anyone who is not living that experience. But for someone living that experience, it's a whole lot for them. And one thing about microaggression is even some persons that gives those comments and those jokes do not even know the level of the negative effects it has on the experiences of these individuals.
We've actually I was part of this mystery client survey in Nigeria, and we're trained to go to the hospitals in Nigeria to go and tell them, this is who I am. I want to get treated for penile warts or for STIs. Or you let them know that I wanted to see the outcome, And me, I went to one hospital, Mushi. You know Mushi now? And as I just entered there, I just saw one nurse with her holier than thou gown. And I told her, I came for, I think I have STI. And she said, STI. She just attended to me. And I told her, I am Bill. I like men. And me. Because she was asking me if I should be my sexual partner. I said my sexual partner is a man. So she first got, I started to preach. That is against her religion. She couldn't even attend to me. It was that bad. She said it is even against her religion for her to attend to me. Now you call yourself a professional. Whether I am queer or not, you are meant to attend to me, health-wise. But she allowed her religion, take the better part of her. And that was how I left the hospital.
For some, the harshest form of discrimination doesn't come from their workplace, but from the very people they should be able to rely on, their own families.
So my siblings are the barriers I have, especially my sisters, my family, my uncle, my dad, and my elder sister. 3 of them has been barrier to me concerning getting work and being at workplace. So that's just it.
I'm married for about 15 years now, but it's as if I have to deal with 15 years of, trying to persuade someone to be with you, try to do whatever the person kind of want you to do because he married you out of pity or something like that, and sometimes the kind of emotional, some languages, that she uses sometimes when you have a little misunderstanding, just as if he's doing you a favor. That one alone contributes a lot. Sometimes I find it difficult to even go home. Stressing with the fact that the work issues, when you go home, you can't even do a little, you are being just kind of exhausted, just having a little issue. So you are living your life as if you are the mercy of, oh God, who knows what will happen today, and you feel like crying, but you don't know whom to share your tears with. Even the place you feel that you have your comfort zone are no longer your comfort zones. And a lot of people are actually in this kind of state, but they don't know how to express themselves.
Even in career path, where there is no risk of health hazards, the discrimination remains the same. In offices, corporate spaces, and professional settings, individuals who should be judged solely on their skills and abilities are instead burdened by the weight of their health status.
To the retail job,
working there for some time, and all of a sudden from nowhere, we had to go do tests. It was funny, like tests. Okay, I'm not in the kitchen. I don't do cooking and stuff. So why do I have to go do tests that they need my blood for it? But we couldn't ask, even if we asked, nobody was willing to tell us. So both the kitchen persons, and in fact most of us there went to, because we have some other queer guys that work staying together. Most of the kitchen guys too, I think 2 or 3 of them are. And we actually went, they collected the blood sample, which we already knew as status already. So they were paying well, you understand, but after some time we asked to like stop, that will get back to us and stuff like that. We just knew that was the end. And we knew why. Though they didn't tell us why, but we knew why. Okay, so you just have to take it like.
There is a company that I applied for years back. It's a security company anyways. I had their test. What I just got to know is that they didn't call me again. And that's the last interview. I passed the last interview. They didn't call me. I have to ask my pastor, because I got it through my pastor. I was like, they didn't call me. They just like, and what happened? What did they say? Okay. They just told me that I should go and check myself. I said, I know what is happening. Check myself for what? What did you see? Tell me the result of what you saw. They said, no, they can't tell me. I was like, even if you see anything, this has to do with security. It has nothing to do with my health. So why this? I don't want to mention the name of it. So since then, I didn't want looking for a job. Is that
What we normally see as a challenge is that of stigma. Stigma is a major problem. You see somebody is performing well in the office because you decide to do medical tests and discover that somebody is HIV positive. You tell the person that he's no longer fit to do the work. As I'm sitting here, does I look like I'm not fit? So why should you be telling somebody who is HIV positive that is not fit to work? That is a major problem. And people we need to continue to sensitize people to advocate that people living with HIV can work. They are okay, they can work.
So I tell people that people are ignorant when they fear the unknown. So for example, you just see someone who doesn't even have an idea of what HIV is, or probably has heard about HIV, and the misconception the person has heard is, oh, once you have HIV, death sentence. But they're not even aware that you can actually use antiretroviral therapy, to manage the disease. So in the workplace, there's so much stigma and discrimination, But if you compare, as at 2009 and 2024, I would say there's been a whole lot of awareness, around HIV. So comparing 2009, 2004, there's a huge gap. There's a huge increase in awareness. I won't lie. So 2009, just like I told you, most of us didn't even know what condoms and lubricants were. We just have sex, and a lot of people, within the community, got HIV because of, lack of awareness to how you can actually safeguard yourself, behavioral, and everything. So in 2024, I would still say that yes, people are aware about HIV, awareness, but there's still stigma and discrimination within the workplace. So for example, I'm HIV positive and I don't work within the NGO spec. I work probably in a multilateral or bilateral organization, private organization, and maybe my boss or somebody finds out my HIV status, and they are not even prepared mentally on how to address staff in the workplace with HIV, and may begin to have issues with them. They might feel that, oh, make you no come give us HIV, let us, and everybody starts to discriminate me in the workplace. So I'll also say job insecurity. Sometimes, in the country at most, sometimes you want to apply for a job, for example, and they ask for your medical history. So this has served as a barrier over time. So these are some of the challenges that I would say that HIV persons, face in the workplace.
I think the most pressing issue is using HIV policy as a precondition for employment. One. Two, probably in the course of employment, they are gone for HIV tests, and they realize that you are HIV positive, and they have to lay you off. So unlawful termination of employment because you're HIV.
Yeah.
And the third one is without consent of the person, having a test, conducting tests on patients or employers without their consent.
Yeah.
So it's actually, all these things are discriminatory, and they are breaching the rights of these individuals. And I've seen instances, at least recently I heard of one, obviously maybe a precondition to employment, whereby they have actually sued the person. It was actually a precondition to actually, so I think on realizing that he is positive, they had to withdraw his name out, and that was not part of the condition for the employment. So he had actually taken up the matter in court, and I think hopefully there will be some damages.
Our legal expert and psychologist who we spoke with offered some solutions and statutory backends that protect workers from discrimination at the workspace due to their health status.
Yeah, so the laws against discrimination in Nigeria, the laws that protect persons from discrimination in Nigeria, they are general laws, and then there are more specific laws that apply to the workplace, and then there are more specific laws that apply to health status in the workplace. So when we talk about the general laws, we talk about the Constitution of the Federal Republic of Nigeria, for starters. So there's section 42 that outlaws discrimination on a number of grounds specifically. Of course, it defines discrimination, the denial of benefits that other people get to access, or the granting of privileges that you deny to other persons. Yes, so in addition to the Constitution, there are a number of other laws. So there is the Health Act, the National Health Act, that also outlaws discrimination on the grounds of health status of anyone. There is also the Nigerian Labour Act, which also outlaws discrimination on a number of grounds in the workplace. So now the Labour Act applies specifically to the workplace, but even if it did not exist, the Constitution is sufficient in itself to provide for discrimination in the workplace. In addition to that, there is also the HIV Act, which also outlaws discrimination on grounds of HIV status. But it does not only do that, it does not stop there. It makes it illegal for employers to force or require employees to undergo any testing whatsoever. I think it works together with the Health Act in that except it is of a medical procedure or test that is required by the nature of the job, employers are precluded from requiring employees to undergo tests, and also precluded from discriminating or punishing employees on the basis of their health status or HIV status. Yes, even in the Labour Act. So you could also talk about international anti-discrimination treaties and conventions. This is because in the Labour Act empowers the National Industrial. So when you talk about things about workplace discrimination and the like, the National Industrial Court has exclusive jurisdiction to handle those issues. And the Labour Act also enjoins National Industrial Courts to incorporate international treaties and conventions to which Nigeria is a party in ascertaining labor-related issues, including, of course, labor rights and workplace discrimination. So I like to think that yes, there are the legal provisions against discrimination, while they did not specify sexual and gender minorities. I think the laws are usually exhaustive because they do not allow any grounds for discrimination. They mention sex, they mention gender, they mention ethnicity, tribalism, health status, and there is also the fundamental rights enforcement procedure. Fundamental rights enforcement procedure rules enacted by the Supreme Court, by the Chief Justice of the Supreme Court. It enjoins the courts that in enforcement of fundamental human rights in Nigeria, that they should give them an expansive and progressive interpretation to ensure that the rights and liberties of persons are protected. So yes, I do believe that the legal protections for sexual and gender minorities and persons living with HIV in the workplace are very robust and exhaustive.
We are the key populations, right? And there are many ways, to collaborate to strengthen, the workplace policy that accepts and protects us. Maybe when they discover that we're HIV or not, it's very, very simple. What we can do, or what we should be doing, is reaching out to these companies. It's very simple. You write letters and tell them, okay, this is what we want to do. They are not aware. They don't even know about things like this. We want to come and train you people on workplace policy for HIV people. So maybe for companies that don't like to hear the word LGBT, for example, there are ways you can use public health angle and say, okay, LGBT persons or maybe gay men are more vulnerable, to HIV because of this disease, that, and but we're using the umbrella of public health. So nobody's saying, oh, there's a law against these people, because that's what they tell you. So people just want to use human rights, but there's a law. So if you want to really, really get the job done, you come through public health. So I think that's how Key Population Network can actually collaborate, with the.
I don't have access to specific instances from organizations, but I can share some general scenarios where these policies might succeed or fail. Yeah. One, we have case of anti-harassment policy enforcement. Support through confidentiality policies and instances of policy failure. Actually, that's more like the second one. Actually, the first one I would tag successful implementation. That's where we have case of anti-harassment policy enforcement and support through confidentiality policies. And then second, we have instances of policy failure, that's ineffective non-discrimination enforcement and lack of proper training. So, if you would like me to explain more on this case of anti-harassment policy enforcement, okay, so I have a case where an employee reported being harassed due to their sexual orientation. So the company probably followed this anti-harassment policy and conducting a thorough investigation and taking appropriate action against the harasser. So the affected employee received support through counseling services. And the incident led to further training sessions for staff on the community sensitivity.
They can actually take up the matter in court, seek legal redress. I think that's the only thing I can think of right now, and that is the best thing they can do, seek legal redress. So instead of the whole issue of calling out on social media, I don't think it's. It doesn't yield results, and you're exposing yourself the more. So going to court to seek your redress, you get they infringe on your rights. So you can get the damages and everything, and they will learn their lesson. So they will not have to do it to any other person coming behind. The principal legal protection, which is the Anti-HIV Act of 2014, is the principal.
Okay.
So we have the Constitution of the Federal Republic of Nigeria. We have the Labour Act. We have the Data Protection Act of 2023. We have the National Industrial Court Act. And we have the National Industrial Court Act policies. Another decided cases of the National Industrial Court, because it has to do with labor. So the appropriate court to go to is the National Industrial Court.
But even in the most challenging environment, there are glimmers of compassion.
Concerning that support system, that would be my manager. She has been supportive right from the day one I applied for the work, because where I work, they usually rotate the managers because there's so many branches in Lagos. So they rotate them every 3 months. So even despite the fact that she's not working with our branch, she still talked to me over the phone. Then I was collecting drugs from an hospital. So I pay money to collect drugs because I didn't know about the NGOs and stuff. So she would give me the money. She would say, because we don't have medical allowance and other stuff. So she would be like, don't worry, I will give you the money. At the end of the month, you can pay me. If you don't have, no problem. And she has been really, really supportive concerning that.
I've never been in a support group. I've never had any support aside a few friends and then my parents.
To me, it's my grandma. She's even the one that has to go for the test. Then, back then. Just notice that, what's happening to you? You're getting slim. What happened? I said, have I ever been fat? She said, no. She knows the kind of son that you are. So go for this. When I go back home, I gave her the. She said, I don't know what is there now. Tell me what is there. I said, okay. Money, cocoa. I said, I have HIV. You have HIV. She was like, is there any solution? I was like, see this man that's supposed to like, is there I said I'll be using drug till I die. He said, this is drug now. If you use the drug, till now, she'll be the one calling me. Alpha, don't take the drug. And she's 90.
Wow.
Have you taken your drug? And what about those your people? Who is there with you? I said, nobody's there. You don't have to be alone. Get someone.
Experts argue for a shift in workplace culture, calling for educational campaigns to reshape how organizations view and handle HIV-positive employees.
I would recommend that kind of project that they were doing before, that they should be expert patients that will be attached to some organization who will be able to counsel, or from time to time, employers should beckon on NEP1 to give them somebody who will speak to their staff on behalf. It mustn't be directly to because some people may not even disclose their status, but with proper counseling. If that person does not want to take drug regularly, he would learn to take it. He say, if somebody seems to be hopeless, he will now understand that he's not hopeless. He can still be what God has destined him to be if he or she takes his drug well. So I will recommend such a project to employers. I will also recommend employers to also seek knowledge about HIV, because it's lack of knowledge that make some of them to say that to dismiss or sack people living with HIV. They should seek knowledge.
But individually as a person, I'm actually thinking in that direction, because I represent the gay, bisexual community. So because we have at the KP Secretariat, we have different typology. So we have the TG community, we have the FSW and MSM and the PWID community. So sometimes when you want to talk about your community, you actually have to talk about every other typology. So it's not just me now talking as an MSM, but I have to talk about something that cut across the other three typologies.
As night falls over Lagos, we remember those who carry invisible burdens by day, who walk with a silence forced upon them. Through understanding, we can end the silence, ensuring that HIV-positive individuals, regardless of identity, can live without fear.
Every day in Nigeria, qualified individuals are denied jobs, stripped of their dignity, and pushed to the far corners of the society, not because they do not have skills or ambition, but because of who they love and the health condition they live with. This is the reality of thousands of gay, bisexual, and queer men who have sex with men living with HIV. Despite their talent and potential, they face relentless discrimination in the job market. They endure stigma and discrimination in their workplace, and they suffer under the laws that criminalize their very existence. This isn't about statistics or distant news reports. It's about human rights being unjustly marginalized and destroyed by fear and prejudice. The consequences of this discrimination extends far beyond those directly affected.
Breaking the silence begins here, with you. Because a true workplace does not discriminate. It embraces, supports, and protects. And every person deserves that dignity.